A 67-year-old retired engineer from Portland went 6 months without ejaculating. He thought he was being disciplined, that he was accepting his age gracefully. What his body was actually doing during those 6 months would change how he sees masculinity forever. By month 7, his prostate sent him a warning he couldn't ignore. And what happened next made him wish he'd known this 15 years earlier. I'm Dr. Mei Anderson, and for 25 years I've specialized in helping men over 60 reclaim what they thought was gone forever. And here's what I've learned through thousands of patient consultations. Most men your age are making a critical mistake with ejaculation. Not because they don't know better, but because nobody's ever explained what's really happening inside your body when you stop. This isn't about taking supplements. It's not about medications that numb sensation or scheduling appointments for invasive procedures. What I'm going to explain today has to do with timing, frequency, and understanding a biological rhythm your body has been following since puberty, one that doesn't stop at 60, 65, or even 80. The man I just mentioned? He learned this approach in one 15-minute conversation. And what happened to his energy, his sleep, and yes, his performance, made his wife ask what had changed. She didn't recognize the shift immediately. It was subtle at first. But within a month, she pulled him aside and said, "Something's different. You're smiling more." In my practice, I sit across from men who tell me the same thing in different ways. They say, "Dr. Anderson, I just don't feel like myself anymore." They're not talking about a single symptom. They're describing a dimming. Less energy in the morning. Less interest in things they used to enjoy. A quiet frustration they can't quite name. And when I ask about their sexual health, most of them look down. Some change the subject. Others make jokes to deflect. They assume that part of life is over, or that wanting it makes them inappropriate. One patient told me, "I thought I was supposed to age gracefully. Doesn't that mean letting go?" Here's what I tell them. Your body doesn't retire. Your prostate is still producing fluid every single day. Your hormones are still signaling. Your circulation is still trying to maintain itself. And when you ignore those systems, they don't go quiet. They start breaking down. The difference between men who maintain vitality after 60 and those who fade isn't genetics. It's not luck. It's understanding that your body is still trying to function the way it was designed. And it needs your cooperation to do it well. Now here's what changed my entire approach to treating men over 60. I used to think infrequent ejaculation was just a symptom of low testosterone or circulation problems. I'd prescribe hormone therapy, recommend circulation supplements, suggest lifestyle changes. And sometimes those helped. But they never fully addressed what my patients were describing. That sense of being disconnected from themselves. Then I discovered research from the Male Reproductive Health Institute that flipped that assumption on its head. They found that the relationship works in reverse. In men over 60, regular ejaculation doesn't just reflect good health. It actively creates it. It signals your endocrine system to maintain testosterone production. It keeps prostatic fluid from stagnating. It tells your cardiovascular system to prioritize pelvic circulation. In other words, you're not avoiding ejaculation because you're declining. You're declining because you're avoiding ejaculation. That single insight changed how I approach every consultation. Because once you understand that ejaculation is a signal, not just a release, everything about male health after 60 starts to make sense. Let me paint the picture of what's actually happening when months pass without release. First, there's the physical cascade. Prostatic fluid thickens. The gland itself can become congested. Not painful, not dramatic, just a dull pressure you might dismiss as getting older. Nighttime urination increases because your bladder is compensating for a prostate that's not draining properly. You wake up once, then twice, then 3 times a night. Each time you tell yourself it's normal. But it's not age, it's stagnation. Your morning erections disappear not because you've lost function, but because blood flow to the pelvic region has deprioritized itself. Your body is efficient. When it thinks a system isn't being used, it redirects resources elsewhere. That's not failure. That's biology trying to conserve energy. Then there's the hormonal drift. Without the feedback signal that ejaculation provides, your testosterone slowly downregulates. Not dramatically, There's no single day when you wake up and feel different. But over weeks and months, you wake up later. Tasks feel heavier. You stop initiating, not just sexually but in conversations, in decisions, in life. Men tell me they stop suggesting weekend plans. They defer to others. They sit quietly in rooms where they used to lead conversations. It's subtle, but it's real. But here's what my patients describe that breaks my heart: the emotional withdrawal. One man told me, "I started sitting on the couch more. Not because I was tired, because I felt like I had nothing to offer anymore." Another said, "My wife would reach for my hand and I'd feel empty, like I was there, but not present." A third patient described it as watching my own life through glass. He was there, but separate. Observing, not participating. This is what stagnation does. It doesn't just affect your prostate. It affects how you show up in your own life. It changes how you see yourself. And over time, that internal shift becomes external. People notice. They just don't know what they're noticing. Let me tell you about Richard. He's 68, retired from civil engineering, lives in Denver with his wife of 42 years. When he came to see me, he'd gone nearly 8 months without ejaculating. He told me, "Dr. Anderson, I thought I was past all that. I didn't want to seem desperate or inappropriate." He tried testosterone gel after his annual physical showed declining levels. It made him irritable and didn't improve his energy. He'd tried circulation supplements he'd seen advertised online. They did nothing. His doctor suggested it was just aging and to accept it. But Richard wasn't sleeping well. He'd wake up 4 times a night to urinate. His energy was flat. He described it as moving through fog. And his wife had stopped trying to be intimate because she felt like she was bothering him. She'd reach for him in bed and he'd pretend to be asleep. He said something I'll never forget. "I feel like I'm disappearing and nobody notices because I'm doing it quietly." That's when I asked him one question that changed everything. I said, "Richard, what if the problem isn't that your body is done? What if the problem is that your body is waiting?" He looked at me confused. "Waiting for what?" "For you to tell it you're still here." Here's what most doctors miss, and what Richard's previous doctor completely overlooked. Everyone focuses on testosterone levels, blood flow, prostate size. But those are outputs, not inputs. The real issue is signaling. Your body is a feedback system. When you stop ejaculating, you're not just storing fluid. You're sending a signal to your entire endocrine system that says, "We don't need this function anymore. Shut it down." Your brain listens. Your testes listen. Your prostate listens. And slowly, quietly they comply. That's why supplements don't work. They're trying to force a system that thinks it's been told to retire. You can flood your body with external testosterone, but if your brain believes the reproductive system is offline, it won't matter. The signal is missing. But when you reintroduce the signal, when you remind your body that this system is still active, still needed, everything changes. Not overnight. Not dramatically. But consistently, measurably real. Harvard researchers tracked men over 60 for 18 years. They found that men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer. But here's what they didn't advertise in the headlines. The benefit wasn't just cancer prevention. It was prostate drainage, hormone regulation, and circulation maintenance. All from one simple biological function. The men in that study weren't superhuman. They weren't chasing performance. They were simply maintaining a rhythm their bodies recognized as normal. Think of your prostate like a sponge. When you squeeze it regularly, it stays soft, pliable, healthy. When you leave it sitting in fluid for months, it hardens, swells, and loses function. That's not a metaphor. That's literally what happens at the cellular level. The tissue changes. The ducts narrow. Inflammation creeps in. Your brain releases dopamine and oxytocin after ejaculation. These aren't just pleasure chemicals, they're maintenance signals. Dopamine tells your brain, keep this system active. Oxytocin reduces cortisol and inflammation. Without them, your baseline stress level slowly creeps up, and you don't even notice until you feel chronically tired. One patient described it perfectly. "I didn't realize I was carrying weight until it lifted." So here's what Richard needed to understand, and what you need to understand. The solution isn't more testosterone. It's not better circulation. It's not even stronger erections. The solution is re-establishing rhythm. Your body has a natural ejaculatory rhythm that's been running since puberty. For most men, that rhythm is every 3 to 5 days. After 60, it might stretch to 5 to 7 days. But when you go weeks or months without release, you break the rhythm. And once it's broken, your body assumes the system is offline. Here's the key. You don't need to force performance. You don't need a partner. You don't need perfect erections. You just need to reintroduce the signal. Remember Richard? Here's what I told him. Your body isn't broken. It's just waiting for permission to work again. He sat back in his chair. Permission? Yes. You've been telling your body for 8 months that this system doesn't matter anymore. It listened. Now you need to tell it something different. Now let me explain exactly what I told Richard, and what I'm telling you. First, set a rhythm, not a goal. Choose a frequency that feels sustainable. For most men over 60, that's once every 5 to 7 days. This isn't about performance, it's about maintenance. Mark it mentally, like brushing your teeth or taking a walk. You're not chasing climax, you're maintaining circulation. Richard asked me, what if I can't? I told him. Then you start where you are. Even partial stimulation that leads to any release is enough. Your body doesn't need perfection. It needs consistency. Second, create the right environment. You don't need arousal to start. You need relaxation. A warm shower, private time, no pressure. The goal is to let blood flow to the pelvic region naturally. Gentle stimulation, even without full erection, is enough to signal your system. This is physical therapy, not recreation. Many men tell me they feel awkward at first. They've spent months or years disconnecting from this part of themselves. That's normal. Treat it like rehabilitation. You're not indulging, you're restoring function. Third, focus on the release, not the experience. This might sound clinical, but it's powerful. Ejaculation after 60 isn't about intensity. It's about completion. Even a partial erection with release sends the full hormonal signal. Dopamine, oxytocin, testosterone feedback. Your prostate empties. Your pelvic floor contracts. Your brain registers. System is active. The quality of the erection doesn't determine the quality of the signal. Completion does. Fourth, notice the reset. Within 24 to 48 hours, most men report sleeping better. Morning erections start returning, not full ones at first, but partial. That fog lifts slightly. By week 2, energy stabilizes. You'll notice you're less irritable. Small tasks don't feel as heavy. By week 4, you feel fundamentally different. Not younger, but clearer. More present. Men describe it as coming back online. That's it. Every 5 to 7 days. Relaxed environment. Focus on release. Notice the changes. No pills or doctor visits. No expensive treatments. Just reconnecting with a rhythm your body never forgot. A 2019 study from the European Urology Journal found that men over 65 who maintained regular ejaculation had significantly better pelvic floor muscle tone. That means better urinary control, better erectile rigidity, and better overall pelvic health. Not from exercise, but from function. The body maintains what it uses. When you stop using a system, it atrophies. When you resume using it, even gently, even inconsistently at first, it responds. Richard started that week. He told me later he felt awkward at first, like he was doing something he shouldn't. His first attempt took nearly 20 minutes and resulted in minimal release. He texted me, "Is that normal?" I told him, "Completely. You're retraining your body. Keep going." By day 3, he texted me again. Slept through the night for the first time in 6 months. That's when he started believing it might actually work. By week 2, his morning erections had returned. Not every morning, but 3 times that week. He said it felt like his body was waking up from hibernation. He also noticed he was initiating conversations again, small things like suggesting where to eat dinner or proposing weekend plans. By week 4, his wife noticed. She told him, You seem lighter. Like you're here again." He didn't tell her what he'd changed, he just hugged her. Later, he told me that hug felt different. "I was actually present for it," he said. 3 months later, he came back for a follow-up. His PSA levels had dropped slightly, not dramatically but measurably. His energy was steady. His nighttime urination had decreased from 4 times per night to once, maybe twice. But what really stood out was what he said. "Dr. Anderson, I didn't realize how much I'd disappeared until I came back." That's what rhythm does. It doesn't make you 25 again. It makes you fully present at 68. I've seen this same pattern with dozens of patients. James, 71, said his brain fog cleared within 11 days. Tom, 66, said his wife initiated intimacy for the first time in 2 years. Marcus, 73, told me he started volunteering again, something he'd stopped doing because he didn't have the energy. Here's what surprised me most about Richard's case, and what I've seen across dozens of men who've done this. The physical changes were expected. Better sleep, improved urinary function, returning morning erections. Those are predictable outcomes when you restart a dormant system. But the psychological shift? That caught me off guard. Richard started taking on projects again. He volunteered to teach engineering workshops at the community center. He reconnected with old colleagues. He told me, "I feel like I have something to give again." That's not placebo. That's dopamine regulation. That's hormonal feedback. That's what happens when your body stops sending shutdown signals and starts sending vitality signals instead. The brain doesn't separate sexual function from purpose. They're connected through the same neurochemical pathways. When one system reactivates, it ripples through your entire sense of self. Now I know what some of you are thinking. What if I can't achieve an erection? What if nothing happens? Let me be clear. This method works even with partial function. The signal your body needs doesn't require a full erection or intense pleasure. It requires completion. Even manual stimulation that leads to release, regardless of erection quality, sends the hormonal cascade your body is waiting for. I've had patients who hadn't achieved a full erection in years successfully reintroduce this rhythm. Within weeks, their circulation improved enough that partial erections became fuller ones. The body responds to consistency, not perfection. And if you're worried about frequency, if 5 to 7 days feels too often or not often enough, listen to your body. Some men find their natural rhythm is every 4 days. Others feel best at 8 or 9. The key is regularity, not rigidity. Your body will tell you what it needs once you start paying attention again. What matters most is that you're no longer sending the shutdown signal. You're reminding your system, we're still here. We're still functioning. Keep the pathways open. One more thing I want to address because men ask me this constantly. Is this appropriate at my age? Let me answer that clearly. Your prostate doesn't care about societal expectations. It cares about biological function. Maintaining sexual health after 60 isn't indulgent or inappropriate. It's essential maintenance, like managing blood pressure or maintaining muscle mass. You wouldn't feel guilty about stretching to maintain flexibility. You wouldn't apologize for walking to maintain cardiovascular health. This is the same category. It's self-care that happens to involve a system society has made taboo. The men who thrive after 60 are the ones who stop apologizing for having a body that still works. If you want more methods like this, approaches that work with your body's natural design, not against it, subscribe to this channel. I share techniques that actually move the needle for men over 60, based on decades of clinical practice and real patient outcomes. No gimmicks. No products to buy. Just information that helps. In my next video, I'm revealing the one morning habit that can restore morning erections in men over 65, even if you haven't had one in years. It has nothing to do with pills, and it takes less than 2 minutes. It's something I discovered by accident with a patient who was doing it for completely different reasons, and the results were so consistent I started recommending it to everyone. I'm Dr. Mei Anderson. Take care of your body. It's the only one you have. I'll see you in the next video.